Getting full knee range of motion after your knee replacement surgery is critical. So in this video, I want to show you 5 things to do to help improve your knee bending. But before I do, I want to talk about things that could potentially be limiting your knee from bending. The first thing that could be limiting your knee from bending is scar tissue. If you have too much buildup of scar tissue, that can actually hinder your knee from bending further. The second thing is tightness in your quadriceps muscle. As we bend our knee, the quadriceps should be able to stretch with you to allow you to bend your knee further. And if your quadriceps is tight, that will not allow you to further bend your knee. The third thing is swelling. If you have too much swelling, you basically don't have enough space inside the joint for your knee to move and bend properly. And the last thing is just stiffness in your knee. If you have too much stiffness in that knee joint or in your patellofemoral joint or your kneecap, that will limit your ability to bend further. Okay, so now let me go ahead and show you 5 things that you can do to help improve your knee bending. The first exercise is called heel slides. And you'll slide your heel back as far as you can towards your buttocks. You can either use a strap to help you pull it a little bit further, or you can use your other leg to help bend it further. You will feel some discomfort while you're doing this exercise. Just make sure that you're not hurting yourself too much, because your body can actually resist you from bending if it's causing too much pain. The second thing we can do is scar mobilization or scar massage. And the intention behind this is we're trying to break up scar tissue to allow your knee to bend further. What we need to do here is use 2 fingers and any lubricant or cream to go across your scar, and that actually helps the mobility of that scar, which will help your knee to bend a little bit further, and that prevents your body from building up too much scar tissue. Third exercise that we can do is a quadricep stretch. Stretching a tight quadricep will help your knee bend further. For this exercise, you can lie on your stomach, use a towel or a strap to pull the back of your heel towards your buttocks. Same thing, do not cause too much pain or your body will start resisting that motion. You can hold it there for about 5 to 10 seconds and you can repeat 10 to 15 times. This next treatment is called patellar mobilization. This is just a fancy word for saying moving your kneecap. Your kneecap floats on top of your knee joint. And as we bend and straighten your kneecap should also follow that motion and go up and down. Specifically, when we bend our knee, your kneecap should slide down. Sometimes this motion is limited following surgery. So what we're going to do is we're going to use our hands to push that kneecap down so we can stretch it in that position and regain some of that mobility to help us bend our knee better. So you can do this about 10 to 15 times to help improve the mobility. The last thing that we can do to help bend your knee better is actually reducing the swelling that's in the knee. The knee joint needs space in order for it to bend fully. And if you have a lot of swelling in the knee, that limits how far you can actually bend your knee. So what I like to suggest to decrease the knee swelling is to elevate your leg above heart level to help decrease the swelling, and you can also use an ice pack for 5 to 10 minutes. Elevating your leg above heart level will help reduce the swelling in your knee, improve the space inside the knee joint, and that will help your knee bend further. That's not to say the knee will not swell again after doing this. Swelling is just a part of normal healing, and it's going to increase and decrease depending on your activity level. So if you're standing and walking a lot, your knee will swell up a little bit more. If you're doing less activity, there will be less swelling in there. But for sure, elevating your leg will help decrease that swelling, so you're moving your knee a little bit better. If you can't elevate your leg above your heart level, what you can do is actually prop it up on a chair in front of you, and that will keep it from swelling as much. I hope this video was beneficial in your case. If you've been struggling with back stiffness when you wake up in the morning, go ahead and click this video above. I'll show you some tips in order to get your back moving better in the morning. Thank you for watching, and if you enjoy this content, please subscribe and hit the like button. See you next time.